to simply prevent this whole downward cascade of treatment, which is linked to enormous costs at its root. Beautiful crowns are great, implants are great, they just cost a lot of money. And what most people forget when the time comes in 20 years, they would have actually been unnecessary. That's why it's so important to me that you understand this well. Welcome to our BioLongevity Doc podcast, your podcast for health and prosperity in the truest sense of the word. A few hours ago, I did a few implants in my practice for several patients for various reasons. That was a great thing, it's a great solution. Implants are a top dental replacement anyway. But today isn't about how great implants are and what alternatives there are, but primarily about how you can prevent needing implants at all through your lifestyle. Because when I often do implants in the practice, I often think it's a shame that this cascade, which ultimately led to the need for implantation today, wasn't interrupted decades ago through appropriate knowledge and behavioral measures. Because it would have almost always been possible. From 30 years of practice experience, I can tell you, health actually begins by avoiding cavities and periodontitis. What supposedly comes across as a bit banal, cavities, periodontitis are such mundane, banal, everyday things. It's true, it comes across as rather everyday and banal, but ultimately, in avoiding these two most common dental diseases, the foundation for lifelong dental health is laid, and ultimately also for prosperity. Because it's simply the case that cavities directly and indirectly don't just make you older, so it's a top measure against longevity, but it ultimately also makes you poorer, or let's say less prosperous, if you also associate prosperity with physical and mental well-being, not just monetary aspects. However, it's also the case that avoiding cavities contributes significantly to fundamentally reducing financial expenses that actually multiply over time across the course of years and decades. I want to briefly go into the typical cascade, how cavities develop, and what you can do through your lifestyle, your diet, and your whole everyday setting to ultimately prevent the development of cavities. It's just a fact that well over 80% of all cariogenic lesions, i.e. holes, are preventable through your own behavioral measures. I want to briefly explain how you can prevent the whole history of the development of cavities, whose late consequence is then implantation. So prevent demineralization. I'd like to briefly remind you, most of you probably know this, but cavities occur if we start with a pristine, healthy tooth, which nature usually provides us with, which is truly a divine gift. From the very beginning, this tooth is exposed to more or less harmful influences in your oral cavity, and now it's simply a matter of using knowledge and behavioral measures to ensure that these harmful factors are suppressed, prevented, and that, in principle, no damage occurs. What is damage? Damage is a demineralization or decalcification, to put it simply. And this decalcification actually happens daily in our oral environment. It's a moist environment where there's a constant exchange on the tooth surface between demineralizing and remineralizing effects. So some mineral will always go into solution and is essentially lost, but at the same time, natural repair mechanisms in our oral cavity through mineral-rich saliva and so on, and an appropriate pH value, can also contribute to remineralization, repairing these minimal, microscopic or nanoparticulate damages. And it's simply about knowing how this works in principle, which means you have to prevent constant acid attacks and promote a remineralizing environment. How do you prevent this? By practicing good oral hygiene, preventing plaque bacteria, because they ultimately metabolize sugar and carbohydrates into acids, which in turn causes demineralization on the tooth surfaces. And of course, by avoiding sugar and low molecular carbohydrates. The important role of saliva must also be considered, because saliva as a neutralizing medium in the mouth not only neutralizes acids and clears or flushes away certain substances, but above all, through its mineral content and appropriate pH value, it also acts like a buffer substance and remineralizes the tooth surfaces, the hard tooth substances as we call them, enamel and dentin. And these constant equilibrium conditions, balance or imbalance in total over time and frequency, ultimately result in something like an account balance. Is the account drained, meaning the tooth is demineralized and a cavity or simply loss of substance occurs? Or is it in a healthy balance, everything in the green, and we have no demineralization? Because if we don't succeed in preventing these cavities, it's ultimately just a matter of time, a matter of how much sugar you eat, how poorly you brush, that holes simply appear in the tooth, the common cavities, carious lesions. And then the measure is either to do nothing, then the hole keeps getting bigger, and eventually the decay reaches the pulp anyway. Then there's the necessity for a root canal treatment, and so on and so forth. Or it might finally be detected, or it causes pain. Then you get the first filling or first restoration. And with that, you must strictly ensure that the quality of it is very, very good. Because a cheap, quick filling that's poorly done and has leaking margins is only a superficial solution, because ultimately the damage is only briefly halted and simply postponed to a later point in time, months or years later. And then the next restoration has to be done. And that's rarely smaller than the previous one, but tends to be larger or much larger than the former, depending on how much decay formed underneath and how much larger the lesion has become. So early detection, timely diagnosis, precise x-rays, clinical diagnosis is very, very, very important. That's not exactly addressing the cause, but it is at least an early detection. Regarding the cause, you have to do a lot yourself by optimizing your diet, avoiding an acidic environment long-term, and ideally keeping the frequency of acid-forming windows as low as possible. That's why it's also so important to brush your teeth especially thoroughly before going to bed, including the interdental spaces, because that's typically where decay begins. And don't be bored by such lectures on decay, but that's just how it is. If you know how to prevent decay, you won't need an implant decades later, and that's really what this is about. I've already mentioned the quality of the restorations. It's enormously important that the quality of the fillings, whether it's a composite filling or a ceramic restoration or a crown, partial crown and the like, the quality, the marginal integrity, the bonding quality, and also being free of decay underneath is enormously important so that the whole thing functions as long as possible. Because even composite fillings, which aren't that exclusive if they're very well done and the adhesive technique is carefully applied by the practitioners, can potentially last for decades. Of course, not everyone, but theoretically, especially smaller, well-made ones can last extremely long. And even larger defects, which are often treated with ceramic restorations using high-quality modern adhesive techniques, can function successfully for decades if well made. How is success defined? That no new decay occurs, that the tooth is restored with integrity, so to speak, and this restoration fulfills its purpose for as long as possible. Of course, nothing lasts forever, but in fact, periods of well over 10 and even well over 20 years can be achieved here, but only with good execution. And if you otherwise have a bit of luck, meaning that the prior damage from existing decay, for which the patient is usually partly to blame, is ideally not too deep and close to the nerve. What else can be done? What else can you do besides all the cavity preventing measures that I've already described in simple terms? You can, through good nutrition, good micronutrient intake, especially worth mentioning here are vitamin D3, K2, magnesium as a cofactor, but of course also enough minerals. Calcium is usually present in sufficient quantities in our food anyway. It's just often not absorbed well enough and also not transported into the appropriate compartments. So in other words, we don't want it in the blood vessels, but we want it in the bones or in the dentin-forming inner part of the tooth, so in the teeth, to put it simply, because even damaged teeth have a great protection and repair mechanism. And it works like this. The pulp with the dentin-forming cells, the odontoblasts, from the inside, if tooth damage has occurred, for example through trauma or much more frequently through a cavity or a very deep cavity, is able to wall itself back in protectively through so-called tertiary dentin formation. So it forms, again, just as it did in embryonic development and also in early childhood, it also forms new dentin to basically protect itself. And this mechanism can certainly be supported by nutrition and supplementation so that these regeneration and repair mechanisms simply work better. So a deficiency of vitamin D3, K2 and magnesium is certainly indirectly also a contributing cause of cavities alongside all the many other things. The quality of restorations is crucial if it was previously forgotten to completely prevent cavities through appropriate preventive measures, which would be the gold standard, so to speak. So ideally, what we really want is to stay fit and healthy for as long as we possibly can with our own natural teeth and without needing any restorations. And since we tend to live longer today with all our great longevity measures, then in the past we also have to take this very long expected lifespan into account and basically protect and care for our teeth so well that they don't just last until the age of 30, as they might have in the Stone Age, but that they actually last, let's just say as a goal, until 100. And that would usually be possible I say usually because, of course, there are genetic weak points, there are enamel formation disorders and so on. There are people who are simply genetically less well equipped. And for such people, of course, this statement only applies to a very limited extent. But since that's only a very, very small minority, it generally does apply. And as a rule, you could completely prevent cavities by well over 80%. Even if you only find out and understand this later in your own dental life history, you can still do a lot to avoid future consequential damage from preventable cavities. So it's never too late. And of course, dental health begins as a milestone in childhood and even early childhood, really. But ultimately, every life is different, and you can, of course, still turn things around towards health later on. Everyone should just use the information as soon as they have it, because by doing so, they can not only increase their own longevity, but of course also secure their own wealth. I'll get to the financial calculation in a moment. Now, what does this typical, actually avoidable treatment history look like? To put it simply, first there's a small cavity in the tooth, then a filling is done, which lasts, maybe because it wasn't done well or was supposedly cheap and quick. It didn't cost much, but it didn't last long either. After a few years, it has to be replaced because nothing has changed regarding the causes of tooth decay formation, or because perhaps the quality simply wasn't good. New filling, larger filling, decay occurs again, it has to be drilled out further and must be restored once more. Okay, that happens 2, 3, 4 times, depending on how the cycles go. And typically, purely statistically, the nerve is damaged at some point. So there's a nerve inflammation, or medically correct, pulpitis. It can be reversible. It's particularly annoying in the truest sense of the word if it's irreversible, throbbing pain and so on. And then even the best brushing doesn't help anymore. In principle, if the symptoms are really like that, various endodontic measures must be taken. So the endodontium, what's inside the tooth, just has to be treated. There are various traditional and new methods of endodontics to ultimately get the tooth pain-free somehow and preserve it. With classic endodontics, opinions already start to differ. You have to differentiate a bit, depending on the phase of life and age and the overall context. But to put it simply, classic orthodox conventional medicine tries with great methods, extremely elaborate and sometimes quite successful, to stuff dead teeth so well, meaning to mummify them, so that they fulfill their function as a chewing organ in the oral cavity for as long as possible without pain and largely free of inflammation. This aspect is usually fulfilled quite well. However, one must also factor in monetarily that at this point, if it's done to a high standard, whoever it is, either the patient themselves or the insurance already has to put several thousand euros, including a crown for example, into such a tooth. And the long-term success rate is, strictly speaking, moderately high, especially with multi-rooted molars, i.e. the back teeth, which have the most frequent need for root canal treatments. Simply because the back molars in a typical life history were the first to see the light of the oral cavity, so to speak, and are the first to be exposed to a karyogenic environment there, and typically, statistically, they are the first to start this caries cascade. Small hole, big hole, huge hole, too late, root canal treatment. And that's exactly where we are now. And that's why these are simply the teeth where root canal treatments are statistically most often necessary, and they're also statistically the most common teeth to have endodontic failures years later. This has other causes as well, namely the multiple canals and multiple roots and very complex root canal anatomy, which simply makes orthograd root canal treatment more difficult. It makes permanent disinfection and cleaning of these multiple root canals mechanically difficult, so there are always residual bacteria, or almost always, although strictly speaking, one study says residual bacteria are always present after years. And those usually lead with a delay to endodontic failures with corresponding inflammation and so on, possibly with pain or even without pain, and that in turn often leads to the need for an implant if you want to replace teeth that can't be saved. And to top it all off, these areas also have the highest failure rates, especially in the upper molar regions, because you often have anatomically unfavorable bone conditions there as well, which then also reduces the likelihood of a successful implant or the long-term success of an implant. So statistically, these jaw regions have always had the highest implant failure rates, so it's worth it in many ways to go all the way back to the source and prevent the very first cause, the development of caries at its root, or the silent root cause, as I call it in my book. Feel free to read it at the very beginning, because that's the most intelligent, efficient, and by the way, most ethical and by far cheapest method of preventing damage. And that's what this episode today is really all about. The basic story of caries is actually the same for all teeth, but it's just particularly typical for upper or lower molars. And if you manage to use lifestyle factors that are in your own hands, like nutrition, regular dental care, and what I'll call environment control, which includes the microbiome, which is heavily influenced by lifestyle factors, not smoking, oral hygiene measures, remineralizing dental care routines. There's a lot you can do nowadays to simply prevent this whole downward treatment cascade, which involves enormous costs, truly at its very root. Nice crowns are really great, and dental implants are also great, but honestly, they just cost a significant amount of money. And what most people forget when that time comes in 20 years, they would have been unnecessary. That's why it's so important to me that you understand this well, because it's just the way it is. It's a law of nature, and the smartest and best health measure, and thus longevity measure, is prevention. And prevention has to do with one's own, let's say, discipline, but it also has to do with knowledge and awareness. And everyone should at least know about these opportunities and then decide for themselves responsibly how to take charge of their own health or not. If it hasn't been taken into one's own hands, or accordingly not, let's call it coached, because actually we dentists are health coaches, strictly speaking, and only secondarily repairmen or implantologists or restorers of teeth. That's also a great thing, but it's even better to avoid it from the ground up. That's why we don't call our podcast something like Tooth Doctor or something similar. Of course, indirectly, it's also a lot about that, but it's actually about the fact that we are the Longevity Doc podcast, strictly speaking, the Bio-Longevity Doc podcast. Why? Because biological dentistry today actually has some truly very, very good and advanced methods, which can offer really very, very good solutions that go well beyond what is found in traditional conventional medicine. But above all, I also want to create an awareness of how to make the need for these solutions, keyword metal-free ceramic implants and the like, superfluous as well. I have to go back briefly to my previous remarks on the subject of root canal treatment. That was just the conventional track. In strictly biological, holistically oriented dentistry, one actually tries, as a matter of principle, to avoid root canal treatments as a permanent solution. So as an interim solution, it's certainly a good thing, especially when it comes to preventing pain or waiting for a certain developmental age to make a later implantation possible at all. It's about space conditions, jaw growth, and jaw development, and so on. But in holistically oriented biological dentistry, we try to permanently eliminate dead teeth from the organism because they are dead organs. And for, let's say, 10 or 15 years, we've actually had great possibilities here. The key word here is modern ceramic implants, not as an end in themselves, but as an ideal emergency solution, strictly speaking, because you can actually use them to replace dead teeth, which are usually inflamed and can cause significant damage to the organism. Not necessarily, but they can. It's about bacteria that constantly come out of the dead teeth because they are still present there and multiply. It's about toxins, meaning cadaverine, highly toxic decay products, biogenic amines, for example, which can of course cause enormous damage throughout the entire organism without any pain, through many different mechanisms. We can't even go into that today. And of course, around these latently infected roots, which act like a bacterial reservoir, an inflammatory reservoir, or a reservoir for the causes of inflammation, chronic silent inflammations usually develop, often called silent inflammation. Why silent? Because they don't usually hurt. Sometimes they do, but usually they don't. And yet they represent a major cause for the development of many, many different chronic systemic diseases. And that's why dead teeth are usually, though not always, a problem in the long run. And they should at least be precisely diagnosed and individually assessed to see if there's a danger or not. There are also a few other tests that can be done. And then every patient has to decide for themselves, independently, whether they want to get rid of this personal skeleton in the closet or not. There are various options. I don't want to judge. Everyone has to do that for themselves in the end, but apparently one always has to be politically correct these days. So decide for yourself and be informed. But both ways, whether conventional or very, very consistent, radical, biological, holistic dentistry, which is also a very important health trend internationally, or rather a sustainable movement, so definitely not a fad, because more and more people are realizing how important getting rid of silent inflammation and causal treatments is for overall health improvement. Everyone has to decide for themselves exactly what they choose, but in both cases, it is truly the very best way to completely avoid the need for any invasive dental treatments through genuinely effective prevention. And that is largely possible nowadays. Now for a few calculation examples regarding the monetary consequences of missed prevention. So if through some personal oversights or perhaps oversights in early diagnosis or oversights in adequate timely treatment, these early damages were not treated and not adequately removed, what happens then? First investment, first filling actually unnecessary, then second, third usually more complex and expensive. Then it can lead to the first root canal treatment. Many hundreds of euros per tooth, or possibly with high quality restorations with ceramic onlays, maybe repeat work, and so on, which can swallow up a few thousand euros before a root canal treatment even becomes necessary. That can then, depending on whether you go to a specialist with a lot of technical and time-consuming effort and material expense, you can certainly spend several thousand euros on multi-rooted teeth nowadays. It varies by country, of course. And then usually a partial crown or a full crown is added on top, and then that's another maybe 1,000 euros, maybe 1,500 euros depending, so that you can easily pay several thousand euros just for high-quality restorative care of a root canal-treated, multi-rooted tooth in total. Mind you, all of it could have been avoided. And I mentioned at the beginning that many of these endodontic treatments can still have a problem after several years. And it's not uncommon nowadays for that to lead to a dental implant, traditionally titanium, but more modern, innovative and biocompatible today are ceramic implants, which are very well proven by now. It's even more expensive than titanium, so there again several thousand euros, usually combined with some bone augmentation methods that often become necessary, and multiple aesthetic treatments, long-term temporaries and so on, so that another maybe 4, 5 or even more thousand euros are added on top. That means it would be absolutely great if you could completely prevent this entire treatment cascade, which in a worst-case scenario might soon amount to 15,000 euros. So remember, put simply, tooth decay doesn't just make you old, it also somehow makes you poor. I haven't even mentioned the so-called secondary costs and secondary inconveniences. First of all, it involves a huge number of appointments in total, mostly more or less unpleasant, sometimes even painful. It's about travel costs, travel expenses, loss of work, unpleasant situations, compromises in daily life, not being able to eat well, post-operative pain after all kinds of treatments, anesthesia, numbing, other inconveniences, follow-up treatments, any mishaps that happen in between, like the temporary filling falling out, or some secondary complications like biting on a stone, the whole tooth breaks apart, then everything was for nothing again, everything out, start over, or an implant after all. So this whole long tail of problems can ideally be completely prevented by super efficient know-how prevention. So it's about giving you the tools and knowledge to invest really smartly in your own longevity. In this overall context, it's even more important to me to shed light on a completely different aspect. And I can say from my own practice experience, patients very often come to me for some routine examination, or some might have a little pain, but most of them don't. And they often haven't been to the dentist for many years. And then you find, wow, very, very many deep carious lesions, meaning cavities, sometimes reaching the nerve. Without any pain at all, yes, that happens. So pain is generally a rather poor guide for two reasons. Statistically speaking, even very, very deep, truly dramatic carious lesions reaching the nerve often don't hurt at all, surprisingly. And on the other hand, sometimes just exposed tooth necks or some kind of micro crack issue, or something very, very, very limited and actually undramatic, can regularly trigger relatively strong everyday pain and discomfort. So pain as a guide is a very, very inaccurate indicator. That's just my appeal. That's why it's actually worth going to your trusted dentist occasionally to have them check if more or less everything is okay. Of course, you need appropriate x-rays for that and thorough clinical examinations. You also have to properly feel for the invisible things, check old filling margins, crown margins and so on for tightness. And often, especially after long multi-year absences, very large damages are suddenly detectable. Then, of course, these treatment needs are discussed and then also carried out. And just in time, meaning just before the nerve, the tooth is often still restored. And everything is done to keep these teeth vital, even though nothing hurt before, but the decay had penetrated extremely deep, already through one's own neglect or the neglect of others. And then it's not uncommon for the following to happen. After adhesive restorations that were very close to the nerve, these teeth then temporarily are sensitive for a few days, weeks, sometimes even months, or even really hurt and sometimes can even die off afterwards. Finally, and the tooth nerve becomes irreversibly inflamed into irreversible pulpitis, so that typically only endodontic measures like a root canal treatment are considered as a therapy. And now I ask you, who in your view is causally at fault, quote unquote, for this particular condition? That is, after a restoration was completed, it still somehow led to irreversible damage, which also calls for urgent acute action. Is it the patient who didn't come for many years and just thought everything was fine anyway? Is it the new treating dentist who only just now discovers the damage and works hard to repair it all and just barely manages to fix it? Or is it the previous dentist who perhaps through very inexpensive fillings initially left old or pre-existing? Plugged holes in quotation marks. Who's to blame? Or is it the bad snack break with milk slices and sugar? Or the cola when going out in the evening? Or the one from McDonald's? It's hard to say. So please tell me what you think is to blame for the need for treatment. And always remember, every need for treatment, no matter how little or extra, can systematically lead to subsequent inconveniences at a not so low rate. Statistically speaking, adhesive restorations that correspond to modern dentistry today, typically well-made composite fillings, ceramic restorations, adhesive restorations as they're called, lead to postoperative sensitivities as they're called in about 10 to 20%. In other words, it hurts a little bit afterwards. It's almost always only temporary, days, weeks, and then disappears on its own, depending on how close it was to the nerve. And there are also other effects like microleakage, i.e. nanoleaks, and many other things that can lead to such sensitivities. So nothing is without side effects, unfortunately. The only thing that has no side effects is a healthy lifestyle. On the contrary, that has many positive side effects and really consistent prevention, and you're the one who has that in your hands. The other, equally important, perhaps even more important, aspect of avoiding the need for implants is the prevention or timely treatment of periodontitis, because periodontitis is also one of the most common diseases worldwide, i.e. chronic non-infectious diseases. And this is mostly preventable through one's own lifestyle measures and targeted prevention and appropriate prophylactic measures. Of course, there's a genetic component that not everyone has in their own hands. There are people who have a very high genetic predisposition to developing periodontitis, but that's actually more of a minority. And for them, basically the same thing I'm saying now applies, only to an even greater extent. But implants are cool, great dentures, they work really well. I could tell you about them for hours and show you 1,000 cases, it's really great. But the best thing of all is to prevent the need for implants. And in addition to the already mentioned caries cascade, which is the main cause of tooth loss, periodontitis is the main cause and the most common cause of tooth loss, especially in the second half of life. And here too, early practice is key, which means periodontitis should be diagnosed very early and treated adequately and in good time. And of course, the causal environmental factors that favor the development of periodontitis in the first place must be systematically eliminated, or kept as small as possible. Nutrition plays a huge role in this. How much fiber, how much sugar, how many healthy fats, healthy oils, enough proteins, minerals, vitamins, very, very, very important. The omega-3 index is essential. The vitamin 3 supply, vitamin D3 supply, is enormously important, as are K2 and magnesium, as cofactors and so on and so forth. Antioxidants of all kinds, vitamins A, C, E, D, E and all others and many other trace elements, zinc, selenium and so on. Because it's a whole concert here, which like small gears in a clockwork simply have to interact in a very complex way. You can't say, like in a clockwork, which gear is the most important, but ultimately they all play an enormously important role so that the time is displayed correctly afterwards and the clock simply keeps running smoothly. And that's exactly how it is there as well. One's own personal oral hygiene routine always plays a very important and key role. That's pretty obvious anyway, but above all, what really matters is macronutrition, that is, the overall quality and composition of the diet that someone follows. The keywords here are fiber, antioxidants, fresh, wholesome and natural food items as opposed to bad foods, ultra-processed foods, that is, highly processed foods, which are enormously harmful through very different mechanisms. And of course, sugar as the main drug in a negative sense, which really plays a key role in a negative way, similar to the development of tooth decay, not only through plaque formation, i.e. dental plaque formation, locally, and plaque with its billions of bacteria causes the inflammation that ultimately leads to the destruction of the bone, the tooth-bearing bone, and to a so-called loss of attachment, which for normal people means loose teeth, exposure of the tooth, and ultimately to more and more inflammation, pocket formation up to tooth loss or even toothache, inflammatory pus pockets and so on. Sugar is also extremely negative in another respect because by ultimately triggering insulin resistance, it also causes a complete derailment of the overall metabolic state, in which obesity is ultimately also indirectly triggered, and through this whole metabolic imbalance, several factors cause a more pro-inflammatory overall situation, apart from a more acidic metabolic state, which also makes its contribution. And this overall mixture is extremely negative and promotes periodontitis. This means that one must tackle all these different environmental factors at their root, not to mention, of course, the microbiome as well, meaning the composition of the bacteria is also very, very important. And that's exactly why it's so vital to detect periodontitis early, because it doesn't actually hurt. So early probing, basic periodontal exams, and if needed, an AMMP8 test as a pre-early diagnostic. But I believe that clinical diagnostics in everyday practice are still the most important thing before any symptoms appear. Speaking of symptoms, if someone happens to have bleeding gums while brushing or anything else, it's an urgent warning sign to head straight to the dentist to have them check if gingivitis or periodontitis is present, because the earlier it's found, the better it can be treated and the less damage it can do. Ultimately, we're in a good position if we catch periodontitis early, and we're in a much worse position, and it's a costly position for a patient if we detect periodontitis late. Why is it more expensive for a patient when periodontitis is detected late? Because first, the treatment is much more complex, material intensive, time consuming, and ultimately more expensive. And to make matters even worse, it's also less likely to be successful. That means you have to invest more money, and on top of that you get a poorer outcome. And then you end up needing an implant anyway. The only question is whether that's 3, 5 or 10 years down the line. That's why I'm appealing to you. Treat it early, treat it correctly, treat it intensively, and treat the root cause. Think nutrition, personal oral hygiene, and the quality of restorations, because that's often forgotten. Overhanging filling and crown margins are, of course, prime spots for plaque to accumulate, and those in turn trigger periodontitis and cavities. You can also lose a tooth due to cavities and periodontitis. Statistically speaking, that happens quite frequently, so you can basically have lice and fleas and then syphilis on top of that, so it's best to avoid it all. And that's why here too, just like with the progression of cavities, the quality of restorations is incredibly important. The transitions must be clean, no gaps should form, and it must be easy to clean. And then, through your own consistent oral hygiene and a consistently good diet, low sugar, sugar-free, low in AGEs, advanced glycation end products, and so on, free of oxidants, you have to counteract oxidative stress. Healthy oils, omega-3 status is incredibly important. It's almost the be-all and end-all, because generally a good omega-3 index, or we all have too much omega-6 and too little omega-3 as a rule in our Western Hemisphere. And that's why we generally need to supplement with high-quality omega-3, and we have to prevent ourselves from consuming too many omega-6 fatty acids through poor vegetable oils, French fries and similar things, or even any cookies fried in unhealthy vegetable oils and so on, because then we simply have a poor balance between pro-inflammatory, which practically corresponds to the omega-6 range, anti-inflammatory, which corresponds to the omega-3 range, So we have to balance that. So we have plenty of omega-3 and less omega-6. And then the overall tendency for inflammation in the entire organism is much better. Consequently, periodontitis develops in a less aggressive manner. The teeth last longer and the gums are healthier. And as a side effect, the brain is healthier, joints are healthier, and vessels are healthier. And the heart is healthier and the skin is healthier. Speaking of brain health, I wanted to briefly mention something else that's very important. With periodontitis, it's not just about teeth getting loose, gums bleeding, maybe bad breath developing, and ultimately losing teeth and then having to replace them with expensive implants, but it's also primarily about your brain being damaged by these bacteria during periodontitis. Because it has been shown already several years ago that these periodontal pathogenic bacteria enter the bloodstream through the gum pockets and can ultimately cause significant damage, long-term damage, and permanent damage throughout the entire organism, including the blood vessels. And they can also cross the blood-brain barrier so that they support Alzheimer's disease, meaning Alzheimer's neurodegenerative diseases, by promoting amyloid plaques, which is the conglomerate that ultimately leads to this degeneration and functional impairment. And that also has to do with periodontal pathogenic germs, among other things. So if you want to stay mentally fit for a long time, you have to remember to brush your teeth in time, to brush them properly with the right technique, because otherwise you'll end up forgetting it anyway. To be able to have a radiant smile with your own teeth and stay attractive in the long run, you have to take the right measures in time so that you can maintain dental health, or in modern terms, your own longevity smile. There's a book about that from us, of course, because that is the be-all and end-all for longevity. Of course, you can put nice veneers on afterwards, but that costs a lot of money again. And everything becomes nice and white. All good, you can do that if you want. However, it's even smarter to keep your own teeth healthy for as long as possible. Giving up unhealthy indulgences is actually just a matter of adjustment. Because ultimately, if you're a bit smart, you just have to see which really delicious foods you can incorporate into your daily life to remove the real killer foods. And it's just a matter of intelligent recipes and intelligent lifestyles to simply change potentially unhealthy lifestyle habits. However, you need time. They say it takes about 100 days, and of course you have to stay consistent and really question yourself in everyday life. Do I need that chocolate bar now? Do I need that Red Bull? Do I need this or that? And you have to somehow manage to incorporate, let's call them healthy treats that you really personally enjoy, so that it actually perhaps even becomes an increase in enjoyment. And it's all just a matter of know-how and ultimately of changing your daily routine. We might have a few interesting recipe suggestions that we can link to here. And of course, we have a 30-day challenge in our membership, which was also announced in the book. What might also be an interesting starting point is the following. Patients are repeatedly sent to me for what is known as a focal infection screening. For example, some kind of heart surgery is coming up or an important joint operation. And then there's always a request to examine the dental system for focal infections. Most of the time we also find something that needs to be treated. That's because you should urgently do that before, for example, the heart surgery or joint operation takes place. But what I was getting at is the following aspect. If it's beneficial for such surgical patients who need some kind of general medical surgery to clear up dental foci, then it's at least as important for you, even without an upcoming heart surgery, to ensure that you don't have any infected teeth. And it's particularly important to know here that infected teeth, meaning foci of inflammation or infection, are usually not painful. That's why people generally speak of silent inflammation, or as we wrote in our book, silent root cause, because it naturally goes beyond many other things, so just as food for thought. If it's important for a surgical patient to be free of infection, it should also be important for the average person without an upcoming operation to go through life without infected teeth. Because from 30 years of practical experience, I can only tell you infected teeth don't just make you chronically ill, they also somehow make you older, because chronic diseases are an aging factor. And in the sense of anti-aging, better aging, anti-illness, anti-chronic disease, anti-infectious, anti-stress factor, it's simply about effectively eliminating silent, clear stress factors from the organism. Because, as the name suggests, with chronic stress foci, chronos, Greek for time, it's just a fact that the time factor is a decisive one. That means that the longer period of time and the more intensely such chronic stress foci are present within the organism, the more significant and far-reaching consequential damage they can ultimately cause. And unintentionally, the dental jaw region is indeed exceptionally closely connected to the entire organism through many different mechanisms. And as a result, it actually has a disproportionately large, potentially negative and also quite harmful effect on the overall health of the entire organism. And that's why it's especially important to ensure inflammation-free and focus-free dental and jaw conditions, or rather to diagnose them and, if necessary, establish them through appropriate restoration measures, simply to exclude disease factors as well as danger factors and risk factors. Indirectly. In any case, you improve your longevity if you remediate foci of inflammation in the dental jaw area, and there are great possibilities today, especially in modern high-tech biological dentistry. From 30 years of practical experience with really many hundreds, in total thousands of rehabilitated patients, specifically the dental-focused rehabilitated patients, regularly report that after they have naturally survived the surgical phase, which is usually rarely a wellness treatment, but that afterwards they permanently, even when viewed over many years, feel much more vital, relieved, in the truest sense of the word, and feel fitter, more pain-free, lighter, and they are mentally and physically more capable. And it naturally has to do with that. Apart from that, we recently published a study, a multi-center study in the European region, which we conducted ourselves. And there we were actually able to show quite clearly with the patient results and treatment outcomes that these quite effective restoration concepts also evidently brought about a significant health improvement in all these patients. And that, mind you, is in a long-term extensive observation with many patients and hundreds of implants. When it comes to nutrition and the silent causes of ultimate systemic diseases and also indirectly dental diseases, you cannot avoid the very important topic of blood sugar, prediabetes, diabetes, or rather insulin resistance. Because it affects an enormous number of people and it is usually extremely well controllable through lifestyle, meaning nutrition and exercise. That means it's actually a typical prime example of how you can positively influence dental and systemic health through your own lifestyle factors. Perhaps first of all, a negative overall metabolic situation, meaning high blood sugar, insulin resistance, obesity, poor blood lipids, and so on and so forth, is not only extremely negative for the entire organism in general, meaning for cardiac and vascular health, for mental health, and so on and so forth, for joint health, but is of course also extremely detrimental to dental and jaw health. Because diabetes is ultimately a risk factor for the development of periodontitis and vice versa, untreated periodontitis is also a risk factor for the development of prediabetes and diabetes. So the two are, so to speak, diabolical twins that influence each other here. And both can be effectively contained at the root or ideally prevented and even cured, in a certain way, but also obesity. This is basically a factor for a pro-inflammatory overall metabolic state, which then in turn periodontitis, for example, or all other inflammatory diseases, including in the dental jaw area, favor. That means if we steer our dietary style towards natural, regional, seasonal, unprocessed, high-fiber food, away from ultra-processed foods, so all the processed foods with all the caramelized sugars, deep fryer fats, unhealthy fats, and so on and so forth. Instead, the right fats, no sugar. Sugar-free, natural, seasonal, rich in secondary plant substances, rich in fiber, very important, rich in minerals, rich in trace elements, and still go into the sun enough to fill up on vitamin D. Or supplement these either through good fish oils or also through actually targeted supplementation with vitamin D. Because in our latitudes we actually get too little sun at the right angle. If we do all that right and then move enough to also break down blood sugar, to break down stress hormones, and to stay fit and train the cardiovascular system regularly, it also has to be trained so that it can function, so that it can react. Life is not static, sitting in an armchair and watching TV, but life is practically also keeping the organism in function, so in motion, in function, in tension, relief, chasing the pulse up sometimes, and also rest phases again. All this together leads to a natural regulation of the blood sugar level, improves insulin resistance and all functional capabilities in general, lowers cortisol, stress level down, increases the ability to regulate. When all this plays together, we not only have world's better values for all systemic diseases and also a correspondingly better own subjective well-being, but we also age much healthier, and incidentally we naturally have much healthier teeth. So everything plays together here in a positive sense, and in a negative sense everything also plays together negatively. And that's why it's in many ways double, triple, 5 times important that we know how it works to some extent. Small sins can be balanced out well, but not the constant imbalance. And if you design all that well, intermittent fasting, for example, is a very essential point here, as is a more ketogenic metabolic state. Then we have the best conditions not only for healthy, natural, strong teeth, a longevity smile, but we also have the best conditions for a healthy brain and a healthy body. And as a result, we not only have the best mitochondria, but also the most power, the most energy for life. And we can enjoy our ever-lengthening lives more and more, and that's what we actually want, isn't it? What is the one concrete measure that you can improve today to invest maximally in your health? Please think for a moment, what is the most important source of sugar in your daily life that you can replace with a better, sugar-free source of enjoyment to get one step closer to healthy longevity? Interestingly, we biological dentists, or as we call ourselves bio-longevity dentists, are actually the ideal longevity coaches. Why is that? It might sound surprising at first because we recognize many things in the oral cavity that represent or bring with them favorable or unfavorable overall environmental and lifestyle factors that the patient is often not even aware of. And long-term dental and oral health is only achievable if these essential lifestyle factors are positively shaped. So we notice relatively quickly if something is not right. That's why we feel called to make a significant, important contribution to improving your longevity. Our goal is to make real, cause-oriented longevity medicine or a longevity lifestyle for everyone, accessible free of charge, because it's not just for the rich and super rich. It's not just about some super elixirs that you simply brush on your skin or apply externally, but rather about truly taking your health and well-being into your own hands through solid, practical know-how and carefully targeted lifestyle management, so that you can ultimately prevent medical costs entirely and make them completely unnecessary in your life. And to have great joy in making the positive effects of these longevity measures, this know-how and this knowledge advantage usable for yourself.